Black Opal invests in what we say the collision of healthcare and technology. So we invest in companies that are either applying or developing highly innovative technology to healthcare and life sciences, and we invest in all the frontier technologies that have applicability in this industry.
How do you create health? In what ways do businesses and their investors who invest in those businesses, in what way do they affect health? And in what ways can they promote health? It's in everybody's interest, in every investor's interest, in every business's interest to have a healthy society. That's just good for business, it's good for investing.
If you think about access, quality, and cost, is there a way to find a perfect equilibrium where you're actually providing accessible, high-quality care at lower cost? That has been like the holy grail in healthcare for my whole career. That happens in certain situations and certain circumstances, but we have so much more to do.
The impact allocation started off around 30-40 million pounds. We grew it to 100 million pounds. It was invested in those things that we knew through our grant making work impacted people's health. So that was a combination both of investing in medical technologies and the life sciences, healthcare services. We invested in housing, we invested in nutrition. We invested in this broader space.
Over 83% of you that listen to or watch this show regularly haven't yet subscribed to this show. So could I ask you for a favor before we start today? If you like the show and if you like what we do here and you want to support us, the free and simple way that you can do just that is by hitting the subscribe button or following us on your podcast app. It helps this channel more than you know. Thank you and enjoy this episode. I'd love to get a snapshot of Black Opal today. Maybe start at the beginning with the mission and then go on and give me some of the headlines.
Black Opal invests in what we say the collision of healthcare and technology. And so we invest in companies that are either applying or developing highly innovative technology to healthcare and life sciences, and we invest in all the frontier technologies that have applicability in this industry. And that really brings together the two backgrounds of the two founders. So I come from healthcare, Eileen comes from deep tech, and we're really trying to bring together those two worlds. The mission of the fund is to, have significant returns, but have positive impact both on the industry that we invest in and on the venture capital ecosystem. And so that's an important, and I know we're going to talk about some of the initiatives we have at Black Opal, but some of those are really to make sure that we are having positive impact on the world using tech for good.
You've raised one fund, right?
We have, yes.
It was like 58 million, if I'm right. And somehow you pulled in heavy hitters like Eli Lilly on the big pharma side and Bank of America and JP Morgan on the financial side. So how did you and Eileen pull that off? Because that's pretty impressive for the first fund with no track record.
So the fund is actually, yes, we're investing out of our first vehicle. The fund is actually $63 million. As you mentioned, we have these amazing institutional investors, Eli Lilly, Bank of America, JP Morgan. We have two fund of funds, Illumin Capital and New Summit Capital, and then, a number of individuals that have come in. We have two health systems also, Atlantic Health System and Henry Ford Health System, who are investors. And I think, it's very hard to raise as an emerging manager. We were a team that came experienced in our relative industries, but had never run a fund together. And we, didn't have a track record together. Eileen had a track record from her many years in investing, but didn't have a track record together. Couple that with the fact that it was actually one of the hardest times to raise a venture capital fund. This is 2022 when, the world felt like it was falling apart. It was, we were not seeing returns. It was a very hard time to raise a venture capital firm. And I think the thing that I think resonated with our investors were a fewfold, right? The first was the kind of industry focus and this idea that healthcare, there's tremendous opportunity in healthcare and life sciences and lots of opportunity to solve problems in this industry. And that bringing together industry experience with venture capital experience is, a really valuable team dynamic because we can both identify companies and support those companies as they go out and commercialize and grow. The second thing is, we're one of the rare female-led funds in venture capital. Less than 5% of assets under management go to female-led funds. We are a fully female-led fund. And I think there is an interest. I think we were able to tap into investors who had a very specific interest in supporting diverse managers, but also wanted diverse managers that had, a good amount of expertise under their belt. And particularly Eileen having 20 years of venture capital experience, there are not a lot of women who have 20 years of venture capital experience, was, I think a de-risking for some of those programs that were supporting diverse and emerging managers. And so, I think it was an aspect of some of the strategic nature of it, in the strategic investors and in others who had an impact focus both on industry impact, but also on people impact.
Just for reference, what are your target returns?
We're targeting top decile returns. And, it's an interesting time to think about returns because we did not invest during some of the very hyped up bubble particularly in healthcare and digital healthcare in 2021. And 2020, 2021, where we had, really high valuations, lots of money raised. And so, we're targeting top decile returns, but also investing at a time when, in fact, it's more of a buyer's market and it's more of a time when we have reasonable valuations. And so both, we think that the thesis of the fund and the sector focus of the fund gives us very good opportunity to meet those return goals, but also the timing of the fund is also a good time to actually be in venture capital because you're ideally investing, and we are ideally investing at a time when valuations are reasonable and we can start to see those significant upticks as companies start to really commercialize.
Let's get into Black Opal a bit below the surface now, and maybe you could discuss Black Opal's theory of change and the problem or the problems that you are trying to solve.
There's probably three big areas in healthcare, or maybe four actually nowadays. I think there's a fourth one that really plays a big role. When I think about healthcare, and this has been the problems that have existed and the way we frame problems in healthcare for my entire career, and that is cost, quality, and access. So how do we keep control of cost in healthcare? How do we improve access to healthcare? And how do we make sure quality of healthcare is high and strong? And I would say that the other area right now in healthcare that's very interesting and another sort of novel problem is how do we make sure things in healthcare are safe and secure, particularly when we think about data and privacy and all these new frontiers of what's happening in healthcare. There's not one single problem in healthcare that needs to be solved. There's a number of problems in healthcare that need to be solved. They are still very big problems that exist, despite lots of trying to change things are big problems that still do exist. And, healthcare is a massive industry. So we spend globally, we spend about $15 trillion on healthcare. In the US alone, we spend $4 trillion on healthcare. And in the US in particular, we spend more per capita on healthcare than any of our peers in Europe who are spending probably, a half to 2/3 of what we spend in the US. As a result, there's a lot of push to try and figure out ways to deliver care more cost effectively, to make that care more available and accessible to people. And then again, to make sure that we are providing the best quality care, whether it's, the best therapeutics or the best diagnostics. These are all things that many of us are trying to work out in healthcare. And as I said, I've been working in this area to try and improve access, quality, and cost my whole career. What excites me about the startup and venture capital ecosystem is just the way companies sort of take a different approach than legacy players. It's very common in healthcare for big companies, big players to say, yeah, it's a problem, but we don't know how to solve that. And we love finding companies that are really finding those problems and solving that.
When I was researching you, I found that you said you support founders who are building as you put it, a brilliant tomorrow. So let's talk about this idea of building a brilliant tomorrow in healthcare. That's a big vision. And when you look at the healthcare system today, as you just mentioned, and I think I'm right, you're investing primarily in the United States. So we're probably talking here today more about the US healthcare system. It's huge and it's complex and it's so big. I have lived most of my adult life abroad, but I did grow up in America and I lived part of my adult life in America. And I get the feeling that nobody really understands how it all works. And if anyone does, I don't think they're saying how it works because they're usually making money off of it. What does that brilliant tomorrow actually look like to you, and how do we get there?
I have a very simple definition of how I hope and envision healthcare to be, and agree with you, Scott. It is a big behemoth of an industry. It has so many players, and on the ground when you're seeking out healthcare or healthcare services, it is like a massively daunting, messy process most of the time. But, when I think about and again, having been in this industry, you're right, it's a messy process, but and I'm very, I really do believe that healthcare is improving and changing, even if it does happen at a very slow pace. My dream is that we get the right care to the right patient at the right time at an affordable cost, right? And if we can start to do that in ways that make it easy for patients, that is a vision of healthcare that I would love to see. And we do some of that, like that happens in certain situations, in certain circumstances, but we have so much more to do. We have, diseases that are untreatable. In this day and age, we should be, we are discovering new ways to treat disease that never were treated before. Things like sickle cell anemia, that we had the first gene editing this year for a condition that we had no way to treat the underlying genetic condition like sickle cell anemia. So this idea that we're developing therapeutics, for example, that can treat patients that we never were able to treat before. We have things in healthcare that are using artificial intelligence to try and help patients navigate their care so they actually don't find it to be so daunting and inaccessible and difficult to navigate, but we don't have to pay, tons and tons of humans to do that kind of navigation, which can be, frankly, really costly for any kind of organization in healthcare. And so this idea of technology really changing things and helping us think about a future of healthcare is something that really excites me. And in that simple way of how do we get the right care to the right patient at the right time and make it affordable?
Simple is good. We can use that. You've described your investment thesis as focusing on the collision of healthcare and technology. So tell me, why does investing in this intersection between healthcare and technology represent for tech innovation versus just investing in a traditional tech-focused VC fund? What opportunities are you seeing there that others might be missing by going into a general tech VC fund?
So, many tech VCs have investments in healthcare and life sciences. I think it is typically part of a portfolio if someone is investing in tech. One of the things that we really focus on is both discerning the kinds of investments that we think are going to do well in this industry, whether it is, as I said, investments that are more of the infrastructure of classic tech that we think have applicability into healthcare and life sciences, or companies that are really purely focusing and playing in the healthcare ecosystem. And the second is really so discerning and understanding the industry to understand where there's problems, where there's gaps, and how these companies can fill the gaps. It takes, there is a level of pattern recognition that happens in any job, particularly in venture capital. And so if you can quickly understand that this is a unique opportunity that this company is tackling, and we know it's going to grow and fill a problem problem that exists in healthcare, those are the kinds of companies that we are investing in. The second is the value that we help founders with. And as you said, healthcare is one of the most complex, you said nobody really understands it, right? It's one of the most complex industries in the world. And yet it is one of the biggest industries in the world, right? It is 20% of our GDP in the US. As I said, trillions and trillions of dollars spent on healthcare, and hugely impactful for patients and their families. And so we work to really help bring value to our companies, to help them really understand how they commercialize, how you navigate this behemoth of an industry, how you define value for your customers, and how you develop product that is not just tech for the sake of tech, but really tech that is transformative and will be adopted by the industry. And so that specialized expertise that we bring is, I think that it helps us both identify the best investments, but also bring real value to the table once we have invested in companies.
One of your main problems you identified when we were discussing your theory of change was access. And there's often a perception that improving healthcare access and making it more equitable has to come at the expense of profitability. But you're a VC, you're going after market rate returns. So you're clearly finding investable opportunities in this space. So how do you identify companies that can both make a meaningful impact at the same time generating competitive market rate returns?
So I actually don't think of access as being something that is at the whim of profitability. One of the things that I think about is if we have an access problem, that means there is more market opportunity that exists right now where needs are not getting met. And so access doesn't need to mean that we are providing free care or care at a significantly lower cost. It's that we're providing care for a group of patients or a market that's just not getting the things that they need. And I'll give you a few examples. So we have an investment in a company that is in the obesity management space. So it's a virtual care company called Flight Health. And Flight Health was founded in 2020 by a group of physicians who were practicing at one of the preeminent obesity management clinics in New York City at Cornell. They were sort of one of the founders of the company was actually the founder of the Society of Obesity Medicine 30 years ago, had been talking about this field for years and years, and had been practicing in this area. And that what they found was actually that they were providing this high quality, highly impactful care, but their waiting list was a year long to get an appointment to see them. And what they were able to do was start a company that provided this care virtually, that provided this care with augmented technology to help patients do a lot of self-management, and to use providers that could be guided by experts, but were lower cost providers. And you think about the market opportunity for obesity medicine, it's 50% of the US population is potentially eligible for this kind of care, and only 2% of those patients are actually getting the evidence-based care that they need. That is a massive market opportunity. That doesn't mean that you're necessarily providing that care for free or very low cost, but you're providing high quality, high value care for a very big population. So that's an example where access was a real problem. This company there's still a big market opportunity, but this company is starting to democratize that access in a very high quality way. Another example is a company that we have called Hyro, which is a conversational AI platform that allows patients to call in or use a chatbot to help them find the right provider for them, to help them navigate the care so that they can get in and get appointments and see the right providers for them. That's an area where they're improving access by helping people actually find care, right? Find where there might be appointments available, who might be a good match for them, what's the best kind of care that they may want to seek out. And that's all driven by technology, and particularly by artificial intelligence. And so all these ways that technology is improving access, for example, doesn't mean that it's not profitable businesses, highly profitable businesses, very big market opportunities, also very impactful on that patient and that provider.
But isn't another one of your main points unsustainable cost? It seems like access has a relationship with cost.
It is sort of this triangle, right? If you think about access, quality, and cost, is there a way to find a perfect equilibrium where you're actually providing accessible, high quality care at lower cost? That has been like the holy grail in healthcare for my whole career. We are already seeing technology playing a big role in helping to create that equilibrium of those three. If you can, again, going back to that example of Hyro, if you can get patients to navigate to the right care, you can actually lower the cost of care because they're not doing, ending up in unnecessary places or with unnecessary care. They're actually finding the right care and then getting the right care. As I said, going back to that mantra, getting the right care to the right patient at the right time, you can then improve access and lower cost.
Let's talk now about your investment process. Walk me through how you actually decide to invest in a company. Like if I were a founder walking into your office tomorrow, what's the end-to-end process Black Opal goes through in selecting an investment that gets you to the point to write a check? And you can start with how you identify your investment universe and get the right people in the door.
We source deals from many different ways. So obviously, we both have very deep and broad networks in healthcare and venture capital. And so we're always getting deals from other venture capitalists or from founders who are sending things our way, from industry conferences where we spend a lot of time sort of out and about. But we also have a number of theses that we explore on an annual basis. And we create something called a global competitive analysis. About 4 of these a year are things that we create where we have a thesis around an area where we think there is investment opportunity, and we do a very deep dive into that space. So for example, we did a very deep dive into the use of artificial intelligence for the development of new therapeutics. Last year, we did an assessment of the use of AI for administrative tasks in healthcare this year. And so that idea of not just taking what comes our way, but then going out and having a thesis and seeking out investments in that space is a way that we source investments. Once we have an investment that's interesting to us, we have a pretty rigorous stage gate process with new investments. We do a qualitative assessment of the company based on the market opportunity, the unique technology or moat that they may have around them, the traction that they have in commercialization, and the people who are leading the company. But we also do, I think most venture capitalists do this, a quantitative evaluation of what we think the returns can be for that company. And that really is based on what we know from exit markets, multiples in the exit market, how much companies will have to raise in terms of new and future capital. And, we model out various scenarios to give us a sense of what is the worst case scenario to what is the best case scenario when we model out the financials for a company. So it's a pretty rigorous evaluation, both on a quantitative and a qualitative perspective.
Do you perform like an impact assessment at the same time that you're doing the financial analysis? And can you describe what that is?
Yeah, so it is one of our qualitative assessments, is understanding the potential or the existing impact of a company. We look at a few different areas of impact. As I mentioned, we'll look at the impact on cost, on quality, on access, on privacy and security. And that is something that is discussed when we do a decision about a company. Do we think there's going to be positive impact on health and healthcare for patients or providers? It's interesting because we do have a number of companies, as I mentioned, that are more on sort of the pure technology side of things. And what we have seen is, sometimes people will ask, well, how can a database company have impact? But we think of impact in not just in those very clear things of access, cost, and quality, but that idea of being able to unlock the power of data and the power of technology is really important. I alluded to some of the companies we've invested in. If they didn't have the infrastructure and the technology to do the things they're doing, then they wouldn't have the impact that they have. And so we also see companies that have sort of a step, they may be a step away from direct patient impact, but we see a clear line of sight to the impact that they can and potentially have, particularly with the partners that they partner with.
You say you're addressing global problems, but your portfolio seems to be largely focused on the US. Who is your primary target? Is it only US companies?
So we ideally would love our companies to have impact more broadly than the US. And we have several companies that in fact do so. We have a company, for example, named Optellum, which is a lung cancer detection company that's based in the UK that sells into the US, but also into Europe and Asia. So has a very broad reach of their technology. We have a company called Conceivable, which is in the IVF space that is looking to go into many markets beyond the US. But what we do find, and even for companies that are outside of the US, from a growth and revenue perspective, the US is by far the largest market. And so in order to actually be a sustainable, highly successful company from a growth perspective, in healthcare, you almost have to come to the US to commercialize. Almost all of our companies have a presence in the US from a commercialization standpoint, but we also, we have networks and support. As I said, we have a venture partner in the UK who can help those companies ideally have more of a global reach. But the truth is that the US is the largest market. And even if you're a non-US company, getting to the US is really important from a commercialization standpoint. And again, one of the challenges is it's a hard system. So, we really try to help those founders, all of our founders, but particularly non-US founders, to navigate the US healthcare system.
Maybe that just means that the US is paying too much.
Well, I mean, we could debate that. There's some evidence, but I've been in the industry a long time. Not that much has changed.
What's your typical ticket size?
So we have two programs in our portfolio. So one is a core portfolio program where we do $1 to $2 million investments in C to Series B companies. Often we're a syndicate partner with other investors given round sizes, but that's our typical check size. And then we have a scout program, which is a smaller checks in typically earlier phase companies where we see potential promise. It may just be early in the company, or it may be before a round is being raised and we want to get to know those founders. So those are typically smaller checks, 100 to 250K.
What proportion of companies that you look at each year end up getting investment from you?
We have 10 core portfolio companies, 8 scout portfolio companies right now. And this is for the lifetime of the fund. We've seen over 2,500 deals in our deal flow. So it's less than 1% actually get investment. I think that is a pretty common number for VCs. It's not, it's not an atypical number, but it is a common number that most deals, the vast majority of deals, don't make it to investment.
It's not uncommon at all. You focus on 5 key areas in healthcare. I think we've kind of touched on some of them, but somehow I've come up with 5. Rising cost, health disparities, poor quality, and medical errors. That's a little bit alarming. And lack of access and uncured and unmanaged disease. That's a lot of ground to cover. How do you balance all these different challenges?
It is a lot of ground to cover, but I think as we talked earlier, there is a lot of interrelation between these areas. If you can lower cost, you might be able to improve access. If we can treat disease, we might be able to improve quality of care. So there's a lot of overlap, I think, with some of the things like the problems that we're trying to solve. As a focus for the fund, these are the big problems that we see in healthcare, and we like to see companies that are tackling these big problems because that means there's a big opportunity. But we also, we do focus on a few sort of areas in healthcare. We call them the D's of healthcare: diagnostics and prevention, delivery of care, and drug discovery and development are 3 kind of areas that we and another framework of how we think about the focus of the fund. And then as I said, we also have about 40% of our portfolio are all the technologies that allow us to solve these problems, whether it's AI, whether it's cyber, whether it's new computing technologies that allow us to really leverage technology to really impact all these problems in healthcare.
Within these 5 areas, how does profitability interact with impact? And I guess there might be nuances between the different areas. Can you get more impact for your profit buck out of certain of those areas?
I would say there's no hard, fast rule that if you're solving one problem, you'll have better impact and better profitability. I think the key thing is, and this gets down to how you run a business, right? Are you tackling a very big problem with a very big market opportunity? I think that's the first and foremost thing. So big problems that have big market opportunity tend to be companies that have opportunity to grow. The question around profitability starts to deep dive into, who are you selling to and why would they buy what you're selling, right? And this gets to sort of that complexity of healthcare, right? If you're selling to a payer, the value of your product is very different than if you're selling to a healthcare system or to a pharma company. And so understanding the particular value that you're delivering to your customer is, I think, one of the most important things that a startup company needs to understand. Because if you have a big market opportunity and a big problem to solve, but you don't know how to sell to the person that needs to adopt that technology or that product or that service, then you'll go nowhere. And so understanding that you need those nuances of, oh, I think a hospital system is going to buy this. We will often ask, well, why do you think that, right? Is it going to improve their bottom line? Is it going to improve the way they practice, that they will really want to adopt this technology? Will it improve revenue for them? These are all kind of key questions when we think about actual profitability and commercialization of a company's product or services.
I'd love to hear about some of the companies that you've backed. One in particular caught my eye was Conceivable Life Sciences, which is doing some pretty revolutionary things with IVF access. But are there a couple examples you could describe what they do and what you hope to achieve impact-wise with them?
I'm so glad you brought up Conceivable, because Conceivable, I think, is a classic. When you think of a Black Opal Ventures deal, Conceivable is a very, I would say, a prototypical deal for us. It is a company that is using tremendous amounts of technology and really cutting edge technology and solving a problem that exists and is really problematic in healthcare. So this is a company that is creating an entirely robotic embryogenesis lab for IVF. So embryogenesis is the process that we take an egg and a sperm and create an embryo for IVF. Currently, it is done by humans, and it's a process where a human will do very bespoke manual processes to harvest the egg, clean the egg, inject a sperm into the egg, and get the embryo created. And we not just is it a very manual bespoke process, but we have a limitation on the number of embryologists in globally, that we can't actually meet the demands that exist in globally for this field. So, we have a problem where we don't have enough people to be able to do this work. And the work that they're doing is highly manual, highly artisanal. And, as a result, it's slow and it may be error prone. And so that idea of actually helping that human do a manual process using a robot is not so unusual. We do it in manufacturing. We do it in so many other industries. This is obviously a hard industry. We are dealing with tiny, tiny cells and, moving cells and difficult to do things. But with the use of visual AI, the use of robotics, the use of all these things that are almost off-the-shelf technologies put together, Conceivable is actually transforming that entire process. And so they are going into a clinical trial this quarter. They've already had many successful embryos created. Their first pregnancy happened this fall, and they're going into a larger clinical trial in the new year.
Well, that's a great story. What about companies like IntelliHealth or Empatica?
Empatica is a company that spun out of the MIT Media Lab. One of the co-founders is a woman named Rosalind Pickard, who is, I would say, one of the pioneers of artificial intelligence, started doing artificial intelligence research and development in the 1990s. She was actually an early professor when I was at MIT in 1990. I think she joined the faculty in 1992, and I was there in the 90s. But she has been one of the people who has really developed the concept of how do you use technology to measure things that are very hard hard to measure, and then use artificial intelligence to predict what may be happening to someone before something happens. And so one of the things there's lots of things in healthcare that are very hard to measure, things like pain, things like stress, anxiety. We use very rudimentary ways to measure that. Empatica has actually developed over 100 biomarkers that help you measure things, as I said, very hard to measure things, whether it's stress or pain or neurologic activity, all things that can now be measured on a wearable device. And you can take all that data and then make predictions from it. And so Empatica actually has a clinical biomarker diagnostic that actually predicts when someone might have a seizure before they actually have a seizure. It's available to patients, it's available to family members for a condition that is very scary for patients and their family members, but can be deathly if you don't realize that someone is having a seizure or maybe at risk for having a seizure. So that is a device that is being used clinically for a very specific neurologic case. There's more development for other areas around migraine headaches, around depression, of using these new biomarkers to do better diagnostics. And they actually also have a very big portfolio of companies that in the clinical trial space that they work with to be able to do remote clinical trials and monitoring of patients all through a device. So again, a great example of really cutting edge technology having very impactful outcomes on patients, but also a very big market opportunity and great opportunity for commercialization.
You referred to your Scout program. Describe how that works and what made you decide to include that as part of your strategy, because I'm just trying to understand what this is and why you do it.
Yeah, so the Scout program allows us to act quickly and invest in earlier phase companies where we think there's high promise. And it allows us to get to know founders and start to demonstrate the value that we can bring to founders, but also get to know these companies very well before we write a larger check. And, there's, I think, twofold things. It builds a really nice pipeline for our core portfolio and for future funds. So it allows us to have real insights into companies we think are very promising and, then be able to make larger investments later on when they're at a more mature level. But it also gets us into deals that may be hard to get into in the future. We all know that venture capital deals can, particularly as companies start to get more successful, can get competitive. And so if we can get in early on and get to know founders through a small investment, it allows us to hopefully get into more competitive deals. And then the third is it actually allows us to broaden our reach. So our Scout program not just includes the core team, but we have a number of scouts who help us source deals. They are investors in the fund, they are advisors in the fund, and it allows us to get a really good, robust deal flow beyond, what a core team has access to.
Technology integration into healthcare comes with unique challenges. And so I'd like to know if you could talk about some of the trickier aspects of health tech. It might be things like getting patients used to virtual healthcare instead of face-to-face meetings, or maybe like getting doctors used to virtual healthcare instead of face-to-face meetings, or perhaps dealing with privacy concerns over digital patient records and so forth. What are these types of issues, and how do you help your companies navigate these challenges?
There is a tendency in healthcare to be resistant to change. I break down technology into a few different areas. I think you've alluded to a number of technologies that help us either deliver or administer healthcare differently, whether it's virtual care, whether it's remote care, whether it's, the ability to write a note without actually having to sit down and type it out on a weekend. These are all the things that happen in healthcare that are sort of behind the scenes. I always go back to, what's the value that you are bringing? When you think about technology we'll use that last example of saving doctors and providers time by not having them have to sit down and type notes. The reason those things get adopted is because you actually, you may be able to have more patients be seen in a day. You may be able to fight physician burnout, and you may be able to, again, kind of lower the cost of delivering care to patients. So with that idea that, yes, technology is very hard to to integrate sometimes into healthcare. But if you can actually show a real value proposition of that technology, that's when you start to see adoption. And again, the value for the customer depends on the customer and the value that you can bring. So I think that there's, as you said, there's aspects of cultural changes that have to happen in healthcare. And the idea of virtual care is a great example where, I'd actually been writing about virtual care as being a potential way to deliver care better and more cost effectively for decades. And there was no adoption of virtual care until COVID hit. And all of a sudden we had this moment where people said, oh, we can deliver a lot of care virtually. We don't actually have to deliver care in person. And sometimes it may take something like that, a very big change that can happen, whether it's policy, whether it's something that's happening in the environment that pushes people to make a change. Those are ways that sometimes we can get adoption of technology. As I said, value proposition is really key. And then I would say the third area in healthcare is there a way to get things reimbursed or covered in healthcare? We see a lot of technologies that are on the clinical side of things where, amazing technology, and yet we don't know if a payer will pay for that. And if you can't get that to get paid for, it gets very hard to adopt. So often when we look at these companies that are still early in trying to figure out product market fit, and whether they, if they're a new enough technology, whether a healthcare player will adopt it, we think about all those things, like what's happening at a macro level, what's the value that you have, and, is it going to be able to get integrated through a reimbursable model, all sorts of things when we think about how you actually get these things adopted. And that's why we do love to see early product market fit, because, I think a key thing is not investing in tech just for the sake of tech, but investing in tech that really has product market fit.
Are your investors exposed to any other unique risks that are specific to your strategy as opposed to general market risk that every investor is exposed to?
Healthcare is a highly regulated industry. And so I think having, this goes back to, is there unique value of being a specialized fund? This is one of the unique values of that, is understanding sort of the key factors of that regulation, whether you're regulated by the FDA, whether you are providing clinical care, all of these are areas where, regulation plays a role. It is, as I said, a highly regulated industry in general. And so, we are very, I think, knowledgeable and cognizant of any potential risks that may happen because it is a regulated industry. And I think our investors put their trust in us because we have the expertise to be able to do so.
Can you talk about how you've seen healthcare access disparities play out in your medical career, and how does that influence your investment decisions now?
I've seen lots of issues in access to care throughout my career. Earlier when we were talking, I told you about, the times where in the early 2000s, I had, all these uninsured patients that didn't have any access to any health insurance, couldn't access any care. We've come a long way from that because of policies in the US. Obviously, in other countries in Europe and the UK, there's single payer systems. They function in very different ways than the US healthcare system. But, this idea of a patient not being able to afford something and that may be life-saving or life-altering for them is, a real tragedy in healthcare. And so when I look at companies, I think, again, if we can find ways to get people covered better in terms of the kind of insurance they have, if we can lower the cost of care, all of those things can really, and if we can get better technology and tools to be able to do so, all those things, I really believe can be improve access, improve equity, and still be very profitable revenue generating companies.
Well, how do you see technology helping to bridge these access gaps?
Lots of ways, right? I think, again, we have a lot of things in healthcare that are human driven. Healthcare, if you go back, decades, healthcare was, a doctor and a patient sitting in a room, writing notes, making a decision, maybe getting paid by the insurance company. So many things have from a technology standpoint have changed that, right? For example, electronic health records. As I said, I didn't have electronic health records when I started practicing. Electronic health records have transformed our ability to understand holistically what's happening with a patient. We can see what happened when they saw a different doctor. We can see their lab work that happened a year ago. All these things that have really transformed how we care for patients all technology driven. Now we're in an age where AI is really taking over a lot of that, right? And in fact, the idea of AI helping a patient find the right care, or AI helping a patient get a diagnosis at home rather than having to go to the doctor's office, all ways that we're improving access to care, lowering cost of care. And the real underpinning of that is technology.
Looking ahead, what gets you the most excited about the future of health tech, and what innovations do you think could really change the game for the type of companies that you're investing in?
So I think it's hard to talk about health tech without talking about artificial intelligence. I equate this, I went to school in the 1990s before we had the internet. And I remember distinctly in 1995 or 6, like one of my friends saying, have you heard of the World Wide Web? And sitting down and like learning about the internet, you move on to then, how phones have transformed our ability to gather and understand information. I think AI is going to be, again, one of those monumental shifts in technology that we're already seeing value from, but it's going to continue to play a huge role in healthcare. And we see a lot of that right now, and all these things where AI is helping us do things that were like so painful to do, like writing notes or, billing an insurance company, like all these things that AI is able to do now, all the way to like helping us make better clinical decisions for patients. And, I think it's going to continue to be a big, big area where it's like the new frontier. What's interesting to me is that we now are at a point where I think healthcare is, adoption of tech is very hard to do in healthcare, but we're actually seeing adoption of AI in healthcare at rates that I haven't ever seen before. And I think that's going to continue. So, it's hard to be an investor in this space and not think about the role that AI is going to play in health tech, whether you're excited or scared about it. But then, what's interesting, and it brings up a whole nother set of things, like how do we then make sure we're doing we're using AI responsibly? How do we make sure data is secure and private, right? Like it just brings up opportunities for new and more companies because you've opened up sort of a Pandora's box of all sorts of things that can happen. So, we think there's a lot going on around AI, but also what's going on around all the things that are needed to responsibly use AI in healthcare.
I expect a lot of my audience, being international, will not necessarily be familiar with Guy's and St. Thomas Foundation. So maybe you could give an overview.
I'll say a little bit about it. So, Guy's and St. Thomas's Foundation is about 800 years old and is one of Europe's largest foundations. And what's incredibly cool about it, to my mind, is that historically it has worked in just 2 boroughs of London, Lambeth and Southwark. So that's about, if you were to think of the population of there, about 600,000 people combined. So roughly the size of Detroit. But if you were to pick an area of the world that you said was a mirror to the world's population, it would be those 2 boroughs in London. What you see of those 2 boroughs is an extraordinary range of outcomes, an extraordinary range and diversity of people all around the world. But also, Guy's and St. Thomas's Foundation was a health charity. It had a focus on, the mission was to build a healthier society. And we saw in those 2 boroughs extraordinary differences in health outcomes, inexcusable differences in health outcomes. So streets that were just 12 minutes apart by a bus journey would have a 14-year difference in life expectancy. I mean, that's a difference between seeing your grandkids or not. It's an extraordinary thing. And so what we were doing at Guy's and St. Thomas's Foundation was to say, let's use our philanthropy to build a healthier society, and let's really get into some of those questions of health inequality and find out ways that you can actually do something very practical about it.
And it's actually connected with a hospital, right?
Yeah. So the history of all the hospitals, older hospitals in the UK, is that they were originally charities. And in the 1940s in the UK, the hospitals became nationalised. The state started to provide healthcare, and that was the formation in the UK of our national health system. But what happened about those charitable funds that had originally been supporting the hospitals? And so those charitable funds became endured, and over time became things like charitable foundations, of which I went to run the Guys and St Thomas's one. And so we set this question for ourselves of how both should we support the hospitals, Guys and St Thomas's hospitals. Guys and St Thomas's is the UK's largest hospital trust. How do we support the hospital directly, but also indirectly in how do you keep people healthy in the first place so they don't need to use a hospital? Because that's the way that you can help a hospital most, is reduce the need for people to go there.
The reason why we're speaking about this, and this is relevant for the audience, is that when you're there, you're managing a fairly large endowment, and a certain percentage of that endowment is devoted to impact. Maybe you can talk about how much is the AUM of the endowment and what percent isn't devoted to impact, and the theory of change that you had for that.
I'll tell a story of how we got there. So the endowment's about £1 billion in size, a little over. But let me tell the story of what was happening as we were tackling this question of how do you keep people healthy for longer? And this will get back to impact investing, but I think it's important to start here. So keeping people healthy for longer is really working out, well, what drives our health? And what drives our health is three things. One, it's our individual genetics, just how we're born. The second are the choices that we make in life. What behaviors do we have? The third is the conditions that we live and grow up and work in. And that is by far the largest thing that impacts our health overall. Anything to 70 to 80% of our health is determined by that. So if we're talking about the places that we live, our house, so think of all the food that we eat, buy from shops and supermarkets, or the air that we breathe, which can happen from both how buildings are built or the cars driving past us. All of those things are shaped by commercial dynamics. And so as you start getting into the question of how do you create health, you start getting into the space of in what ways do businesses and then investors who invest in those businesses, in what way do they affect health? And in what ways can they promote health? And you can say that this is a good thing to do, that it's a morally good thing to do, but actually you can make an even more, in my mind, an even more persuasive argument, which is that actually it's in everybody's interest, in every investor's interest, in every business's interest to have a healthy society. That's just good for business. It's good for investing in. So the reason I say all of that is we're doing lots of work through the grant-making bit of the foundation on really novel experiments around how do you shape the commercial environments around people. We ran the world's biggest ever experiment around behavioural nudges in supermarkets across 200 stores in London, of swapping out really unhealthy food for slightly less unhealthier food, for putting buy one, get one free on the carrots instead of the fizzy drinks, that sort of thing, and working out what could you change in the commercial environment by looking at the till receipts to see were people buying healthier baskets of food and what was the impact on store profitability. Turns out you could do a load of stuff that both made the stores the same amount of money or more money and was also healthier for their customers. And so these stores didn't just do it there. These supermarket chains just rolled this stuff out quietly across the whole of the UK. So we're doing really interesting work there. But this question that really came to me, and many others are asking, but perhaps we were amongst the earlier to be asking, was, well, why are we only thinking about this with 4% of our assets, the 4% that we grant out each year? What is the other 96% doing? And 96 is a much bigger number than 4. More than that, are we investing in things as an endowment that are actively working against those things that we're granting money out for? And why are we assuming that it's more effective for us to give money away rather than invest money to have an impact? And why are we assuming that every problem that we're trying to tackle is grant-shaped? Perhaps some are not grant-shaped, but so that's the sort of space that we got into. Long story short, we became very focused on the question of how do we use all of our assets in support of our mission, not just the 4% that we grant out, but the 96% that were invested. So we then developed a strategy for thinking through that. And so we were the first major foundation in Europe to set a dual mandate to our endowment. And that dual mandate said we needed both sustainable financial returns, but health impact. And then we thought about that health impact or the achievement of that dual mandate in various ways. So we set within the main endowment a certain allocation towards investments that we were testing. We can get into kind of that impact investing allocation. We owned a lot of property and we're quite an active property developer through our endowment. We got deeply focused on the questions of, as a property developer, how do you develop property that promotes health in a way that's commercially scalable? Because unless it's commercially scalable, the health impact won't scale alongside it. Through to, we got deeply engaged, perhaps we can come back to this, with questions of how, as a steward, owner of companies, can we use our stewardship voice to promote health and sustainability and economic sustainability at the same time? So a coherent strategy of how do you achieve that dual mandate. The impact allocation is a bit that people get often quite interested in, although all of it, I would say, is a combined strategy and needs to be done together. But the impact allocation started off around 30-40 million pounds. We grew it to 100 million pounds. And the intent was to learn through it in a direction that would get it to be the full £1 billion of endowment. And what was it invested in? It was a range. It was invested in those things that we knew through our grant making work impacted people's health. So that was a combination both of investing in medical technologies and the life sciences and healthcare services. But back to that story of what's the 80% of stuff that impacts our health? It's housing, so we invested in housing. It's nutrition, so we invested in nutrition. And so these things are sometimes called the wider determinants, the social or commercial determinants of health. So we invested in this broader space. And we had a bit of a learning journey on it as well. We started off broadly by saying, well, let's just get going. Let's just get going. This can all feel quite complex if you try and arrive at it purely philosophically. So let's just try and make some investments. And some of our early investments were in some great funds. For example, funds focused on housing for women and children at risk, and a model where high quality, safe and secure housing is provided for women and children. What pays back that revenue model is essentially government housing support. Now, if you kind of step back a bit, that basically is a government bond. I mean, governments are providing housing support for donkey's years and are likely to for donkey's years too. So it actually looked like very similar to other things that we were invested in if you just kind of looked at it in the right sort of way. But it had a profound impact on people's health. But what we started to find was that we were aiming for win-win investments, by which we said we were aiming for things where the financial returns looked kind of consistent with other things that we're investing in, and the impact was high. Where we got to over time was we started to say, well, that's great, that's a great place to start, but we should really be thinking about this at the level of the portfolio, not the individual investment. Because you can have a diversified portfolio, you ought to be able to do more interesting things with it. And what that pushed towards was more of a barbell strategy, where we started to say, okay, where are there investments that have a deep and profound health impact and that can offer us capital preservation or capital preservation plus? And then to balance that, where are there high-performing, responsible investments that, and when I say high-performing in terms of their financial performance, and how do we optimize which one of those has the biggest health impact? So it became a barbell strategy where we're saying, well, actually the portfolio level, how are we optimizing for both health impact and for financial returns as a whole, which I think at the level of an endowment is an important one to do. And it allowed us a much richer diversity of funds that we could invest in as a result. And I would say a much bigger impact upon the world and much more learning, which fundamentally is what this is about.
When you're discussing investing in housing for disadvantaged women or battered women, are you doing direct investments or are you direct investing in funds like Ben Rick's Social and Sustainable Capital or something like that?
Resonance was the fund that I had to always very careful to talk with equal care and love about these wonderful funds that are out there rather than promote one in particular. But we were investing in funds through our endowment. There were a couple of reasons for that. One was that's what we were set up to do. Not saying it's right, but that's kind of the experience we had as an investment committee as an investor, was investing in funds and how we were just kind of configured in terms of like the number of people we had and what they knew how to do. The second was that we, through our grant making activities, we were doing direct investments. But this was one of the interesting aspects. So through our grant making activities, sometimes it was giving money away. Sometimes it was flexible funding, sometimes it was a loan that turned into a grant if it needed to, and all forms of flexible finance. Where we never quite got to was I was there, but I wouldn't be surprised if endowments do over time, is be able to close the gap that exists between those two different things. So what we were finding is that as we were making direct investments through our grant making activity, that would get to a certain size of direct investment that we're able to do. And that when we're investing in funds, that got to a certain size of fund that we're able to invest in. You'd like to imagine that kind of covers every single capital requirement. Where we were, there was still a gap that we were not covering. And there are endowments out there thinking quite hard about how they're able to address that gap.
So you've made the case of how you started to think about applying capital to solve social problems and health outcomes. What can applying capital not do for social problems and health outcomes?
The easy answer is to say there are some things out there that are just bad for health. So tobacco, for example, tobacco in any form is a bad thing for health. Where I've spent more time focused is on what things can you invest in that could be even better for health than they are at the moment. That's an area I'm really interested in, and it's a vital area for us. The one I've spent particular time on is nutrition. And so let me kind of come at this from a different angle, which is that in the UK, our great economic challenge we have as a country is that we have 2.8 million people who are too unwell to work. The largest single factor behind that fact is ill health caused by diet. There are other contributing factors. Mental health is a major issue, but ill health caused by diet, the food environments around people, and what that means for people's health is playing out in incredibly high levels of obesity in the UK, in the US, and across the world. And this is a huge economic challenge. So quite apart from it being a health challenge, this is an economic challenge. This is a productivity challenge. So what we need to be able to do is identify those business models and those business practices that create diets and create food environments for people where the affordable, the accessible food is also better for people. And that will improve people's health, but it'll also help with those grand economic challenges that we have from issues like food-related ill health. And so what can you invest in there? Well, one of the things that we set up when I was at Guy's and St. Thomas's Foundation was a fund investing in startups that are promoting healthier food that was at a price point that worked for a mass market. That's a great thing to invest in. Now, what happens is some of those startups are successful, a lot aren't. It's an incredibly competitive business, a competitive industry to be in. But the main effect of change is that your big brands and your big manufacturers and retailers see these startups and say, well, that's great. We're going to purchase you, or we might copy what you do. That's less good, but anyway. But in some way, it is good because new food techniques, new food stuff start to come into the food environment at a price point that works for people who are tight on time and money, and so it becomes part of our national diet. So that's a great thing to invest in. But the allocation of capital is both kind of new capital being allocated, but it's also what do you do with capital that has already been allocated? what do you do as the owner, particularly an investor? What do you do as the owner of companies? And I helped found and chair now an alliance of institutional investors. The alliance is called Long-Term Investors in People's Health, or LIFE, LIPH. So the spelling's a bit dodgy, but LIFE. And we have about 7 trillion of assets in this alliance. And we are focused as institutional investors on how do we help companies evolve their practices to do things that are good for population health. And the reason we want them to do it is because it's good for business. It's good for investing. And so the sort of thing that we've been able to do there is, as an alliance, we've been able to work with companies like Unilever and Danone globally to improve the healthiness of the products that they sell. And there's a very direct analogy we can draw to climate here. So lots of institutional investors have engaged deeply around oil and gas and said, look, it's a stranded asset, or certain aspects of it, a stranded asset. It's losing value. We as a long-term investor would like the companies that we're working in to work out how they're going to mitigate the risk of being involved in stranded assets. Well, there are more sugar taxes globally than there are carbon taxes. And so that's why institutional investors are getting focused on food. So it's a long-winded answer, but effectively to say that these are the sorts of ways in which investors can engage around things that promote opportunities to change practices to arrive at better health as a great thing in and of itself, because what is more important to any of us than our health, but also because this has a profound economic and societal purpose.
When you're making your investment decisions, you had to set objectives for investment risk and investment return and impact objectives. Was that iterative? How did you balance those three?
Hugely iterative. So which is back to this point where I said, kind of, what is pioneering practice? In my experience, is standing on the shoulders of other people's efforts and discoveries. So a lot of the work that we did just built upon what had come from others around us. But yes, we did exactly that. We did a lot of work thinking about, well, what drives health? And when we think about health, how do we understand where we want that health to occur and for whom? And with what intensity? We had to think quite hard about, well, what levels of risk were we willing to have in this allocation? We did a lot of work to say, how do we right-size a portfolio as a carve-in of our endowment that we can carry a higher degree of risk in order to be able to learn about how to invest in this sort of way while still meeting the overall returns expectations that the endowment had over a long-term period. There was deep and sophisticated work behind this. We'll get to the work I do at the Impact Investing Institute in a bit, I'm sure. But we now do a lot of work at the Institute showcasing how endowments are thinking about this question. We've got a number of reports to share of how endowments are thinking about setting these criteria, setting the portfolio, thinking about the tactical allocation, right the way through to what's their investment policy statement is as well, because it's all of these kind of very granular things that you need to do.
I think during your time at the foundation and around 2020, you did a parallel stint as chief executive at Impact on Urban Health.
Yeah. So Impact on Urban Health was something that we set up at Guy's and St. Thomas's Foundation. It essentially became the arm for our venture philanthropic work. So the grant making, quite a lot of the grant making activity that was focused on making cities healthier places for everyone.
What were you actually doing with that?
So there we were working on issues around food-related ill health and air pollution and multiple long-term conditions. And we were looking at real-world experiments to find ways that you can reshape environments to make them healthier places. So give a practical example. We ran, you might have heard of the concept of social prescribing. Social prescribing is you go see a doctor and the doctor says, instead of giving you a medication, they say, we're going to prescribe you a dance class, because actually physical connection and combating loneliness is an incredibly powerful health intervention. We ran the UK's first pilot of a social intervention social prescribing focus on debt advice. So you go to see your general practitioner will know an awful lot of things about you and might be best placed to say, well, financial insecurity and illness go hand in hand. If you lose your job, it's hard to keep your health. If you don't have great health, it's hard to keep a job. So these things kind of go hand in hand. So what the social prescribing scheme was doing was people would go see a GP, and the GP would say, well, let me put you in contact. Let me put you in contact with somebody who can talk to you about your finances and see if they can help you get access to all of the benefits or things that the state has offered to you. And profoundly impactful. On average, the people who went on this scheme received £2,000 more each year in terms of benefits that were the state gives to people that they were owed. And these are some of the people on the lowest incomes in the UK. But their health improved as well. So that's what we were doing. We were doing these kind of real world experiments to say, like, how do you just do stuff that keeps people healthy?
Can you describe an example of an investment that you were convinced ticked all your impact boxes, but in the end, it didn't turn out? And what did you learn from that experience?
Yes, I can. And what I learned from it is that we should think that governments would be some of the most secure partners that you could be alongside, but actually often they're the least consistent partners. So it's a call for government stability of when engaging in things.
Now, the converse of that, can you describe an investment that you were skeptical of at the time you invested, or maybe you ultimately passed on it, and in the end, it turned out to be way better than you thought, and you were pleased you invested, or if you had passed on it, you wish you hadn't, and what did you learn from that experience?
Yes, one that we invested in, it led me to a deeper understanding of how digital approaches can scale very, very quickly for great impact. There's a lot to be cautious about in technologies, but there's a lot to be said for scale and impact.
A little over a year ago, you moved to your current role as chief executive of the Impact Investing Institute. So tell me, how did that move come about, and what attracted you to make that move to this particular organization?
Because it's a wonderful organization. I had a fantastic time at Guy's and St. Thomas's Foundation. I was attracted to the opportunity that we have here at the Impact Investing Institute. And that opportunity is let me tell you a little bit about the Institute. So the Institute was set up by the UK government, and it was set up as a non-profit, an independent non-profit, with a mission to catalyse the field of impact investing at large. And what was fascinating about it, and what is fascinating about our work, is that we act as a bridge between the mainstream of financial markets and new economic ideas. So we, as an organisation, we connect the world's largest asset allocators and asset owners with government actors, with foundations, with civic society actors, and really explore this space of what does it take to transform capital markets in support of an economy that's fairer, that's greener, and that's more resilient. So what I was really attracted to by this opportunity is, how do I take what I learned at Guy's and St. Thomas's Foundation, both through our endowment, but the real world work that we were doing through our philanthropic activity? How do I take what I learned in government around the early architecture of a marketplace to say, well, how do we involve the trillions that exist in capital markets in support of this? And I would say that at my very core, I believe that there is a convergence happening. I believe that there is a convergence happening between those of us who have spent careers focused, and I'm relatively new to this space compared to lots, careers focused on thinking about different, impactful and innovative ways to address society and the planet's greatest problems, often through business approaches, and a convergence with those who are responsible for owning or allocating vast pools of capital, particularly over the long term, and their sense of what do they need to be considering for that capital to be successful over the long term. And that's what the Impact Investing Institute sits right at the nexus of, is how do you amplify that convergence? And if that all sounds very coded, for the asset owners or the asset allocators, fundamentally, we have come to an understanding And we need to scale this understanding of what it takes to have a successful economy. And it is one where we're more attentive to environmental outcomes, social outcomes, community outcomes. As I say, not necessarily because these are the right thing to do, but I think they are right, but people's values vary. But purely through the logic of capital markets, that if we want money to exist now and then money to exist in the future, we need to be thinking much greater coherence about the world in which that money is being invested.
Impact investors who are seeking to make social impact, they have to have a theory of change for achieving this. In your case, you're not actually investing in direct outcomes, but you must have a theory of change for you to expand the impact space. I'd like to understand your theory of change for your investment of your time and your resources in the III.
What a great question. So everything starts with a vision, doesn't it? And so our vision is of transformed capital markets. And capital markets, as I say, are supporting a fairer, greener, more resilient economy. What we see is that impact investing is a powerful tool for driving that transformation, because impact investing focuses on the intentionality and measurability in the management of impact. So there's something real that is happening in that transformation. But also it works within the logic of capital markets. So you can see how they can move relatively quickly to bring an impact lens, these tools of impact investing, to capital allocation. We then, in our work, think about our mission, therefore, being of accelerating impact investing, both in the UK and globally, because we work with some of the world's largest capital owners and capital allocators. That, for us, then, has a focus on how do we embed practice, how do we extend it to new places, and how do we experiment in what's needed to really transform capital markets into the future. And then broadly, our work plays out in two different spaces. One is that we run a challenge lab. We look at how do we advance fresh solutions to real-world problems by connecting institutional impact capital to opportunities for impact. And we do that in all sorts of spaces that I could cover with you. And then we focus on field building. How do we increase understanding, engagement, expertise in around the application of impact approaches? What does that all mean for us when you add it up? Is that we've got three things that we measure ourselves by. One is the amount of capital moved for impact. The second is how effective is the impact capital being? How much more effective impact capital is moving? And then finally, that capital is moving where it's needed as well, which is really the focus of our challenge lab. How do you constantly push the edge of how we understand how impact capital and institutional capital can affect more positive environmental and social outcomes? So that's our theory of change.
I've spoken to a few people informally that I know, and some said that they feel that the Institute preaches more to the already converted, spreading the message of impact investing to impact investors, producing lots of research and reports. The question is, how much is it influencing outcomes? So what do you say to people who have that feeling?
Yeah, I'm not sure I agree. A number of reasons. I mean, how does a field grow? It grows out, is the first thing to say. So the converted, everybody needs to become the converted, right? Our work practically is about how do we bring people into this space. So, for example, we do a lot of work with endowments and family offices about what will it practically take to engage in this space. We focus particularly on how do you do it, not why you should do it, partly because some of the why has been won, partly because an efficient use of space is to get those people who are here or close to over the line into doing. And then we do a lot of work to understand how do you get those who are not yet seeing themselves in this space to see themselves in this space. We're running a 2-year program focused on narratives around investment, not narratives around impact investing, but narratives around investment. What is it that investors see the function, particularly institutional investors, see the function of investing to be? What world are they investing for? What is the purpose of their role? And what opportunities does that create for the narratives of impact investing, or what opportunities does it close out as well? So I'm not sure I would agree with that perspective, but what I would agree with is if the spirit behind it is we need to not be in an echo chamber, we need to make sure that those not yet in this space are in this space. I couldn't agree more. Indeed, I would say that's the very mission of this organization.
What are your plans? I know you're relatively new in the post. What are your strategic goals? Where you plan to take the Institute from here?
The strategic goals, back to that embed, extend, and experiment, because that's what we really need to do. There is great practice out there. We need to embed it so that it lasts. And, some of this is increasingly contested. So we need to embed it. We need to extend where we've learned how to do something in one place to others. Let me give a very practical example. A lot of the work that some pioneering charitable endowments have done is deeply relevant to the work of family offices. So you need to extend ideas to kind of adjacent spaces. There's 10 trillion that sits in family offices globally. That's an awful lot of money. And then we need to experiment. We don't yet know how to do everything that we need to be able to do. We don't know all the answers. Not us, clearly we don't, but actually investors, society doesn't yet know all the answers. So we need to spend time finding out, how do we align environmental, social, and community outcomes with commercial impact? How do we crowd capital into places that have been underinvested for a long time? How do we accelerate a truly globally just transition? And so on and so on and so on. And so our work focuses around those sorts of questions. The aspiration of our next 5 years is that we and others that we work with should be bringing £1 trillion more of impact capital into this space. And that's a goal worth going for.
Is that how you're going to measure it?
Honestly, Scott, there's loads of things that an organization like ours needs to measure and does measure. If I were to say that there's a yardstick that's useful to measure ourselves by, it's that. But it's also about the effectiveness of that impact capital, and it's where is it going? There are lots of things to measure. But the quantum, particularly for an organization like ours that is facing into some of the world's largest capital markets players, that's an important element.
You've been listening to SRI 360. If you enjoyed it, please hit the like button and subscribe to get future episodes. You can find an archive of all previous podcast interviews and more articles and information on SRI, ESG, impact investing, sustainable investing, and socially responsible investing at our website, sri360.com. If you'd like to read more lessons learned from world-class SRI investors, get a copy of Scott Arnell's book, Sustainable and Responsible Investing 360. It's a must-read for anyone wanting to know more about investing for positive social, environmental, and ethical impact, all with market financial returns. These are the stories and tactics of those leading the way as sustainable and responsible investing goes mainstream. Sustainable and Responsible Investing 360 is now available in hardcover, ebook, and audiobook format wherever books are sold.